Obsession and compulsion drive all addictions. With time, as the addict life circumstances worsens, he or she may actually want to quit or even decide to quit and be genuine and sincere about that desire. And it may take months or years till they reach that point. But what I'm saying is, even when they reach that point, when they want to quit and are willing to try to quit, the negative reinforcement in particular, basically the withdrawal, the psychological and physical withdrawal, which kick in several hours after their last dose. Once they get into that place, especially if they're alone by themselves, it's nearly impossible to not resume using and to just go through that, allow yourself to go through that when you know exactly what to do to feel well again. And everything in you is telling you that you're dying, which is exactly what it feels like. And not dying in a pleasant way. Feels like you're sinking deeper and deeper into hell. It's torture, literally torture. So without help, the addict, even if they want to quit, is not going to be able to just do that on their own. And I'm speaking right now about opioids because that's my main experience. But everything we're talking about here, there are similar dynamics with caveats for several other drugs. And the dynamics can be just as powerful. The physical withdrawal intensity, the incredible and dangerous sickness is severe in opioid addiction. And I have experience with that, and I'm sharing that. And I want to put out a caution or a warning here that withdrawal from opioids, but also from several other drugs, alcohol and benzodiazepines, is the withdrawal from those three in particular is not safe. It's not a safe process. It should never be gone through alone. This is one of the areas where even doctors don't realize how potentially severe or deadly this situation really is or can be. But people die from withdrawal, from opioid withdrawal complications. The body is put under incredible stress. Can trigger heart attacks, heart failure, stroke, severe dehydration. And for older people with medical condition, it's very dangerous. It is said this is how Jerry Garcia of the Grateful Dead died while in rehab from heroin. But there are several documented cases in young men and women dying in jail from opioid withdrawal. So it can kill anyone. So withdrawal is not something to be taken lightly. It needs to be performed within a therapeutic, controlled, supervised setting with experts who can manage, detect, and treat any potential complications. However, there still is hope. It still is possible for the addict to get help, get detoxed, come clean, and come out the other side clean, as long as they have the appropriate help. Now, as addiction progresses, the patient's life will shrink. Priority on getting and using the drug will shut out all other phases of the patient's life, even important responsibilities like work or parenting. And with enough time, everything else in the addict's life may fade away. They may lose all of their relationships, all of their status, all of their possessions, everything, in pursuit of getting and obtaining more drug. And at the same time, the positive impact that the drug had initially, the positive reinforcement, is less and less. And using is just to avoid the severity of withdrawal. And using becomes necessary just to function and survive. So this is the cruel joke of addiction to opioids, is that the original incredible pleasure never lasts. And the hook comes in that a patient will suffer incredibly unless they continue to use. And really, they have to use to even feel half normal or function at all. Let's talk about what happens in the brain when someone wired for addiction to a substance takes that substance, whether it's alcohol, cocaine, methamphetamine, opioids, or other, into their body. The brain is basically a mass of 100 billion neurons or nerve cells, which form trillions of connections to other cells like circuits or pathways by communicating neuron to neuron. And the chemical they use to communicate between neurons is called a neurotransmitter. The major neurotransmitter in the brain important for our purposes is dopamine. There are brain circuits called reward pathways by which normal human activities are reinforced. For example, with exercise, excitement, eating, sex, and really whatever activities may turn a person on, we can demonstrate a rise in dopamine levels in these areas of the brain in the reward pathways. This is perceived as the pleasure we feel with these activities, such as the euphoria associated with extreme exercise. It appears that the dopamine release in these instances rises 2 to 3 times their baseline level. When a drug, and let's take an opioid as an example, acts on the brain by attaching to nerve cells, an exaggerated intensive rush of dopamine results in the reward pathways. This has also been shown scientifically. For those who prefer alcohol, a similar effect occurs as it does for other drugs. There is even a demonstrated rise in dopamine level found when people act out in behavioral addictions, such as gambling or pornography. This is the physiologic basis of the reward the addict gets by acting out or using. In the case of opioids, the neurotransmitter dopamine level rises as much as 100 times higher than the baseline level, which is incredible. So it creates a huge reinforcement for taking opioids. This explains why many opioid addicts describe their initial experiences with opioids as so powerful, and explains in part why addiction takes hold so tightly. And because of a phenomena known as tolerance, which we will explore in other chapters, the brain becomes or adapts to having high levels of dopamine in the brain, in the system, and will produce less and less of a positive reinforcement or euphoric response or pain relief. Thus, over time, the dose needs to be increased in order to achieve similar effects, whether that's a recreational high or whether that's just to stay out of withdrawal, or if that is pain control. Another phenomenon known as dependence, in which the brain is also used to the drug being there, and without the drug being there, the brain connections and the amount of dopamine released are abnormally low, and the brain can't function. And without that, the brain kind of goes haywire, it doesn't know how to communicate, and that's part what creates all the horrible withdrawal, is this kind of storm in the balance of the brain nerve-to-nerve communication. And so addiction is definitely has a physiological basis. I mean, certainly for opioids, for craving, for needing the drug, and a person really does get hooked to where stopping, even if they want to stop, becomes extraordinarily difficult. I would say humanly impossible by themselves. A major part of what is actually happening is a temporary inability to feel or sense any kind of pain, including mental or emotional pain, and a temporary release from all painful thoughts and memories, even those which are unconscious. The perception of physical pain is not separate from mental and emotional pain, and the opioid, which people abuse or become addicted to, work by removing all those kinds of pain temporarily, really removing the capacity to even feel something unpleasant. So that is a very seductive dynamic. Now, over time, the use of opioids produces less and less of these positive effects, and eventually the person is no longer rewarded with any pleasure. In fact, the using is just necessary to function or to feel normal, basically to stay out of withdrawal. To compensate, the addict continually attempts to increase the dose or potency of drug used, but eventually reaches a wall where maintaining this becomes impossible. This could take months or years, depending on the individual situation. If the addict does not use, severe withdrawal comes on within 24 hours. And even if they do use, all the drug does at that point is keep the person well, or quote unquote fixed, like be able to function. So any euphoria or sense of well-being is gone. So getting back to our original question, the myth, let's try to answer it at this point. Do addicts have the capacity and power to stop? Yes and no. Yes, they can make a brave decision to trust a detoxification and rehabilitation program, check in, accept help, and come out the other side clean. However, it's more complicated than that. Many addicts can't access treatment, don't trust it. It's estimated that only 20% of persons who need treatment access it. For those who are not wealthy, which means for most of us, most of the top detox and rehab centers are inaccessible due to cost. Programs that are accessible more widely and to the poor do exist, but they're sparse and underrepresented in areas of highest need. And there are other roadblocks to treatment. An addict may have no solid information or counsel to help make the choice. I've seen many people back out of detox when the anxiety starts or the withdrawals start before they become completely incapacitated from the effects of withdrawal. Or, like me at first, they may assume there is no help for them. Now, once the drugs are out of the addict system, he or she has more power, because while they may have intense cravings and feel lousy, the acute withdrawal is over and the substance is out of their body. Even then, staying clean alone is a failing prospect. The support of others is key, which is one reason the anonymous programs are so prevalent. And long-term sobriety without a new program for a living is also rarely successful, which is why a program of recovery is essential. And on the flip side, no, addicts do not have the ability to make such a decision to stop and follow through on their own, purely with self-discipline or with proper incentive, unless they have the support of others and a structured program, any more than one has the ability to endure torture. I know this to be true, especially in opioid addiction. It doesn't matter how much they have lost or how sincere they are about wanting to quit. The brain and the survival instinct have been literally hijacked. So we need more high-quality detox and rehab programs to be made available. Then more addicts will have the opportunity to decide to get help, surrender to the situation, and actually follow through in a structured, supportive environment. As far as living a normal life goes, being clean and sober is not the same thing as recovery. Getting clean and recovery are topics of their own, which are addressed elsewhere in this series. But getting clean is just the beginning, because all of the dysfunction, trauma, pain, and suffering which led to drug use in the first place is still there. It can be dealt with. The recovering addict does gain abilities, values, principles for living, and yes, will be better positioned to live a productive life than ever before, as long as they prioritize and follow the recovery plan. Thank you for watching. I will continue to publish videos, and your questions and comments are welcome.